Thank you so much for joining us this evening. I'm Marie Waxel.
And I'm Dan Schaefer. We're on top of the CDC panel's recommendation to vaccinate young children against COVID-19. The final ruling from the CDC's director is expected within hours. That's when pediatricians across the nation can start vaccinating kids ages 5 to 11 with Pfizer's pediatric COVID vaccine dose. It's 1/3 the size of an adult dose. Pfizer says it's more than 90% effective in preventing symptomatic COVID in that age group.
We have team coverage as our Way 31 reporters learned how kids could get a COVID vaccine right here in North Alabama.
I'm going to begin with Way 31's Ashley Carter. She has new details on the crucial role that pediatricians will play in the potential distribution process. Ashley?
Like any other age group, you could go to a pharmacy or a vaccine to receive a child's COVID-19 vaccine, but it's at a pediatrician's office where health officials are saying is going to be very important when it comes to distributing these vaccines to the 5 to 11 age group.
Many younger children could be rolling up their sleeves for the COVID-19 vaccine in just a matter of days. Local pediatricians telling me it's something parents are already coming to them about.
There is a definite concern that it hasn't been around very long, hasn't been tested that long or that much.
When it comes to questions and concerns about the COVID vaccine for children, pediatricians or a family care physician's office is where health officials are telling parents to go.
As a pediatrician, and I know my colleagues in family practice and nurse practitioners that see children, we've for many years discussed risks and benefits of certain treatments, including vaccines, with parents. And so it's a conversation we're very comfortable having. And have gotten more comfortable over time.
Dr. Wes Stubblefield was a practicing pediatrician for more than a decade before he transitioned into his role with the Department of Health. He says the comfortability pediatricians provide to their patients and their parents when it comes to treatment like a coronavirus vaccine plays a big role in the medical decisions a family makes, since the doctor is aware of the child's medical history.
Every parent has to make the decision about what's best for their child. And there are obviously some children, some medically complex children who have respiratory diseases, and others that are at much higher risk for severe COVID disease. And so that's a different conversation that parents need to have with their provider, and making sure that they're making the best decision for their children.
He says parents should feel confident in knowing the vaccine for children has gone through a thorough review process and believes local pediatricians will play a key role when it comes to how widely accepted it will be for this age group.
Very diligently with our local pediatrician family practice community to make sure that we're getting the vaccines in the hands of those providers that are willing to provide those vaccines.
Now, pending that final hurdle, local pediatricians' offices can begin distributing that vaccine as early as the end of the week. Now, the health officials do believe that it will take a little bit of time before we do start to see high vaccination numbers with this age group. Live in Huntsville, Ashley Carter, Way 31 News.